perform a nasogastric intubation. As you can see, I have your patient prepped with the chucks in case he should have a large emesis, an emesis basin, and a box of Kleenex. First thing I need to do is I need to assess my patient after I explain what I'm doing, assess my patient's nostrils to see which side is the better one. Make sure that he hasn't had any nasal polyps on one side or the other, there's no septal deviations. After I have assessed which side I'm going to use, I am going to measure to see how far this tube needs to go down. And to measure, you would go from the tip of the nose to the tip of the earlobe, from the earlobe down to the xiphoid process. Once you get to that mark, you're going to have the tape over here on your bed that you're going to mark, bedside table here, excuse me, that you're going to mark how far that tube is going to go down. So this is how far the tube is going to go down into to reach his stomach. It is an estimate. We will do some checks on it. I will have a glass of water available because he will need to drink some water during my insertion of the tube so that the tube can easily go down. The first thing I want to do is maybe coil the tube just a little bit on the end. You want that little rounded piece here because that is how the normal nasal passageway goes. I'm going to put in a little bit of lubrication in the first 4 inches of this, and then I'm going to insert it. I'm only going to insert it 3 to 4 inches till he starts to gag. I'm going to have him look straight forward as I insert the tube, and as soon as he starts to gag, or hopefully before he starts to gag, you're only going to go down 3 to 4 inches, I'm going to hold it there and give him a break. Then if you have an assistant, you would have them to hold the glass of water so that the patient now can start swallowing. On these mannequins, I will not be able to insert it all the way down to where it's supposed to, but on a real person you would. Now I'm going to ask him to swallow, 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 always holding on to the tube as you push the tube in. Swallow, swallow, and I can't get it any farther. So now I am going to hold on to the tube, do not let go of the tube. I'm going to take a piece of tape, and I have this tape divided with a tear down the middle. This is going to be going on the bridge of his nose, and around one side is going to go around the tube. That's going to temporarily hold it in place as I do my checks. My checks are to take a calf tip syringe, 60 cc syringe. I am going to unclamp this, and I'm going to put 5 to 10 cc's of air down into the tube. I'm going to listen with my stethoscope over the fundus of the stomach, just to the left-hand side of the xiphoid process. As I push the fluid in, push the air in, I should hear a swoosh. If I don't hear a swoosh, I can also take and aspirate a little bit of stomach contents here.